Um, what I'm going to talk about today, a couple of weeks back, I did an overview of CBT for psychosis. And as a somewhat of kind of a follow-up, I'm going to do just a little piece on how you can work with worry as it relates to paranoia, some interesting research out of the UK. And so the agenda is to talk just a little bit about anxiety, and then I'm going to talk a little bit about treatable targets within psychosis and how worry wraps in there, and then some practical strategies, and then a short case example. Hopefully get that all in about 12 to 15 minutes. But the anxiety in our Times little link that's there that you can look up kind of on your own a bit. What we know about anxiety is it's probably one of the most kind of human and common sort of mental health experiences, and then which can then develop into symptoms for sure. And depending upon the estimates that you look at, 8% to 10%, folks will have anxiety disorders. Higher than that. I've looked at the 2019 stats, and they said could be 18 to 20% is pretty common within a year when they survey people by phone about anxiety symptoms. So I looked into the mental health survey that they did, the household pulse survey during the times of COVID. And what they did was they used the GAD. They just used two items, and they surveyed households as part of a Census Bureau kind of survey piece. And what they were getting in the fall months was anywhere 30 to like 39%, 37%, something like that. And again, this is just, they break it down by all kinds of demographics if you really want to look at it, but when they just collapsed it, those are the estimates. So, we are in a time of anxiety. There's lots of stuff on that folks will feel anxious about and worry about. So this may be timely in that regard as well. So how does this relate to psychosis? Dan Freeman and their group in England came up with an interesting idea when they looked at, what kinds of things contributes to psychosis, what fuels it, what maintains it. And what they found was in the column there to the left, the presence of causal mechanisms. Worry was one of the highest ones rated. Anxious avoidance, reasoning biases, insomnia, all those things contribute to psychosis, but worry is at the top of the list there. And when the other way that we look at treatment and CBT is what's the client's preference? What do they want help with? And when you look at the stats there from their survey over 1,000 patients, they found that feeling happier was up there, but worrying less was also up there, feeling more confident, increasing activities, et cetera, et cetera. So based from a data standpoint, it made sense to look at, we can talk about working on hallucinations, treating hallucinations or delusions, but we can also talk about things that are around it. And if you work on these things, these areas, you can have some impact on psychosis. And again, this is just another way of saying it. When we look at the kinds of things that maintain psychosis, worry is one of those variables because of the dwelling and the cycling that goes with it. It provides a lot of fuel to the psychosis. And then there are some other areas that you could also focus on. And this was part of Freeman's project, that what they were kind of identifying was when you work with someone with psychosis who may not be aware or believe that they have symptoms of psychosis, you can certainly work in other areas. And by working in these other areas, you are going to help the person better manage their experience of psychosis. And so that's where this comes from. And today's spotlight is on excessive worry. So worry and how it works. Now, I'm confident that everybody on this call has worried, experiences worry. I mean, it's part of being human, number one. And I think to some degree, if you're in healthcare, mental health care, you kind of have this sort of sensitivity and awareness. And so you kind of think about things and get concerned about things. And so what is worry? So worry is kind of it's both content and process. We detect a threat, if you will, and we anticipate many negative scenarios. And then we hash it out in this self-talk kind of activity with a whole bunch of what if questions. And you can kind of pick anything these days, from just kind of general, my kids are past the teenage years, but they're out late. They're driving a car. They're late. Okay, what's going on? And I can go through 100 what if scenarios. You can choose COVID and infection rates and other things. And you can kind of loop around. Am I doing enough to keep myself safe with regard to that? My particular worry focus when I worked inpatient, Doug and I worked at the state hospital a number of years back, but I did a lot of lethality assessments, suicide risk and other things. And I would go round and round, like, did I cover everything? Do I have everything? And I would get sometimes stuck in these loops, and why do we get stuck in these loops? Well, part of it is the meta belief that doing this helps. This is going to keep me safe or solve the problem or ensure somehow that things will turn out okay. The flip side of the meta belief is that sometimes people have the idea that, oh no, now it's dangerous and uncontrollable. And both of those meta beliefs can kind of keep worry going or keep it strong in your life. when we ask about when worry is a problem, because again, there are advantages to kind of thinking through things and problem solving and so forth. There's no hard and fast rule, although we'll say, we often think about 30 minutes. If you are spending more than 30 minutes on a particular topic that you're looping around, the question becomes, am I adding any more to my solution by spending more time there? And so just as a rough estimate, in a lot of protocols, they use kind of 30 minutes as a place to say, okay, that may be, and again, that's not a hard and fast rule. It's just a way to kind of think about it. And also how much distress and interference is being caused by the worry. Now, one other little bit on this, there is a little distinction with rumination. So rumination is often associated a bit more with depression, sadness, loss. And for those who may have been on there was a training yesterday Stephen Holland did on depression. And one of the things that he reported on was that evolutionarily, what happens when folks get depressed is a lot of energy gets devoted to certain cognitive mechanisms, which he interpreted and talked about as sort of enhancing the ruminative process. And so he wondered about, from an evolutionary standpoint, if there's a role in that to kind of like, okay, I need to amp this energy up so that I can kind of figure out a solution to a problem. So a little sidebar there, but something to kind of think about. The other thing that I'll say about maintaining worry, besides the meta beliefs and the energy, think about our common news cycles. How do our news cycles run? They usually run in these kind of 10, 15-minute or half-hour loops. Then they go to something else, then they loop back to it again. And usually within that loop, there's not a solution that's really offered or even information that's definitive. It just keeps going over the information. That's essentially what worry, kind of that worry loop is all about. So anyway, that's what it is. When we have worry as a problem that interferes, there are certain mental strategies we will often try to do. Suppression and avoidance isn't particularly helpful. Trying to reason with the worry isn't particularly helpful because it just adds more fuel to it. Frantic distraction, not particularly helpful either. Behavioral manifestations are things like excessive reassurance seeking, making lists. Some folks will drink or use other substances to get away from it, avoidance. So those kind of things. And so if we put it together into a loop, because this is what CBT folks do a lot of times, is we kind of come up with cycles, so there's uncertainty. And at the base of generalized anxiety disorder, a lot of authors talk about an intolerance for uncertainty, which then triggers this, if I worry about it, it'll help. I do these worry actions that I just described, safety behaviors that go with it. And at some point there's less distress, so it must work. So it reinforces this worry and avoidance behavior at some level. And so that's kind of what we get stuck in. All right, so how do we get back to psychosis here? So when Freeman and their group looked at their data, they found that folks with persecutory delusions had similar levels of worry as folks with generalized anxiety disorder, GAD. And there was a dose-response relationship between the level of worry and the level of paranoia. So more worry, more concerned about paranoia the person was, or more that it interfered. And they found in other studies that worry was actually a predictor of occurrence and persistence of non-clinical paranoia, which makes some sense if you think about how the mechanism works. And the levels of worry predict persistence of persecutory delusion. So the little image there, more worry, you're adding fuel to the paranoia fire, if you will. So what they did was they said, why don't we provide a very limited treatment just for the worry part of it? And with the premise that a worry reduction approach could help with delusions without even directly confronting the delusion. So they assembled a large group of patients, 143 were screened for schizophrenia, persecutory delusions, and then significant levels of worry, did the randomization process, and provided a only six session worry reduction CBT approach over 8 weeks. And they had a CBT group and a control group. And what they found was the outcome was that CBT significantly reduced worry and persecutory delusions. And the change in the worry scores accounted for 66% of change in the delusion. So being able to have an effect on that without even trying to confront the delusion, whatever the delusion was, working on the worry part actually lessened the intensity, distress related to the delusion. So how did they do it? And just some basic CBT sort of strategies. So first is education around how does worry work, which we just talked about. There's positive and negative beliefs about it. Increasing the person's awareness of what activates trigger for that, or what triggers or activates worry in that person's life. And you can do this by monitoring, keeping track. We have, activity schedules and worry diaries. And at the end of the presentation, there are links. You can get some of these if you're interested in doing some of this kind of work, where you can drill down and get a better sense of, okay, when does this start? How does this get activated? That kind of stuff. And then what you do is you formulate a worry cycle, which is part of the usual CBT approach to kind of understand for each individual how worry works in their life. So once we have a good understanding of these things, the two strategies that they used in their trial was worry postponement and then planning activities during peak periods of worry. And so essentially the strategy here is not to engage the worry, but to try to find a way to postpone it. So when you start to worry, take a break away from it so that you're not engaged in that loop that's happening, disrupt it, and schedule worry periods so that you can spend time worrying at certain times of the day. And then when you identify your plan or when you identify your peak worry times, then you plan things during those times to kind of, again, sort of prevent or limit the likelihood of you getting into that cycle and getting stuck there again. And then this is where things like mindfulness skills and other things are helpful, because the key aspect is letting go. How do I let go of it? One description I heard was sort of like you're swirling around like a toilet bowl. Are you going to kind of stay swirling, or can you just let go and pull out of it? The other image that I like with it, it's sort of like, and this is from acceptance and commitment therapy, it's sort of like a tug of war. If you're pulling on a rope with your worry, you're fighting it, it's just going to keep going. If you let go of the rope, guess what? No more tug, no more struggle. All right. So if you can find ways to let go of the things that are worrying you, you pull the fuel out and you pull the energy from it. So that's kind of the gist of the strategy you try to do. For those who are interested, there's a little bit of a worry postponement script. So if you want to at another time look at the slide in a little bit more detail, but this is sort of the flow of how you would do it with a client. First understand the experience. How often is it happening? What's the advantage to this for you? What's the disadvantage? And usually it's about taking a lot of time or it's uncontrollable. And so you create a little motivation to work on it, maybe change it. Then you normalize it. It's understandable that it causes distress, very common for human beings to do this. It's part of us being, our adaptations in the frontal lobe and our brain being so good. It also does this to us. So you educate them around that a little bit, but we also see it's not working as well as you'd like. So I wondered if we could test something out, do a little experiment. And this is where then you talk to them about, why don't we schedule a time during the day at the same time where you can kind of schedule time where you can do your worries. Now, it's best not to do this right before bedtime, but sometime when you've got some energy and you can kind of really exhaust this. And then what happens is during the day, when you notice that you're worrying, first we want you to keep track of that a little bit, but then also we want to kind of figure out ways where you can let that go. So you know what, I'm going to worry about that at 5:30 when I get home. I've got a half hour. I'm going to worry all kinds of business. I'm going to worry about it then, and then I'm going to be done. I'm going to kind of set a time and I'm going to do that. And so for right now, with this worry thought that's intruding into my awareness, I'm going to postpone it. I'm going to focus on something in the surroundings. I might do a breathing strategy or some mindfulness thing, but I'm scheduling times for the worry rather than getting pulled into that cycle constantly. And then when you have your scheduled worry time, then you focus and you kind of really do your worrying at that time. And that's really the gist of it, to get them practice. And if problem solving is a big part of their worry process, then you can also work on folks, some of the time you can kind of talk with them about, well, let's talk about effective problem solving strategies and kind of help you improve that a bit as you're working along. All right, so that's the main approach there. So I'm just going to give one psychosis related example of this. So a client that I was working with, schizophrenia, really schizoaffective disorder, lots of paranoia, very distractible though, had some other underlying early medical conditions that caused attention to be quite erratic and all over the place. And what would happen is this individual would lose things or make mistakes, and that would activate for this individual this worry cycle. And for this person, it was the devil is doing this. I must be bad. Why am I so bad? Why am I so weak, so guilty? And would just loop round and round this. All right. That was how he made sense of it. It would lead to distress, anxiety, shame, and paranoia, or the police coming after me. Those kinds of things would come up. And this would lead him to dwell on it. And then also to seek reassurance. You'd ask people, are you mad at me? Am I in trouble for this? Is somebody going to get me? He would do a lot of this, a lot of apologizing and so forth, which again, so that's safety behavior and avoidance behavior, which then would just reinforce this cycle. The belief behind it was that, I'll find a solution or I'll make sense of it in some way. So what do we do about it? So we talked about just the steps I talked about before, some education, some normalization around it, discussion around, and he would really understand, he called it obsessing, really kind of made things worse, didn't really help things. So we talked about how do we schedule a time where you can kind of let go of this, and we can kind of practice getting some space from it. And he was very disorganized. So he had a real challenge trying to schedule time. So we would just dedicate times in our appointments to kind of go over this. And we did two things. One was that we would one skill that we would do is like, we would talk about worries while we would sort of throw a football to each other. And we would do this kind of like while we were doing something fun, because you like that. He was able to talk about it, but not dwell on it. We can move on to something else. And I would share a worry I would have, he would share a worry. So there's kind of this mutuality thing, it's a human condition kind of thing. And a little bit of teeny bit of exposure that way too, without getting stuck in the loop of dwelling on it. The other thing that we did was we tried to figure out how do we help him practice the idea of noticing and letting go. I wasn't able to kind of really cognitively do that. But what we would do with a different ball was we would talk about a worry, then we would practice notice it, we would squeeze the ball and then release the ball, pass it on to the other person, which was me. So then so there was something concrete and physical to kind of practice that sort of mindfulness skill, if you will. And with him, repetition was helpful just to kind of build it into a habit that he had. So that was sort of the worry postponement, the practice to be able to postpone were these skills. And then it was really about helping family members to schedule time for him to have time away from his worries. One piece of training family was for them to not reassure him constantly. So we'd constantly be asking him things like, it's fine, it's fine, it's fine. So talked with them around, rather than just saying it's fine and giving the reassurance, talk about collaborative problem solving. Like, geez, I wonder, is this one of those worry moments? Oh, maybe it is. I wonder if we can think about this a little differently rather than getting stuck in that loop. And so coaching them to not inadvertently provide the reassurance that was kind of keeping the process going. And then the other piece, and this was partly a self-soothing and self-esteem building things, rather religious family, and his sister was also very religious. And so we developed a routine where they can kind of focus a little bit on a verse from the Bible, identify the positive messaging, review it, and kind of go over that and affirm that piece. And so creating an alternative pathway where that, rather than the worry around all the negative and threat stuff, he created an intentional cycle where he can reflect on something that was affirming, positive. He wanted to be helpful, to see himself as a helpful person and as a kind person and a cared about person. And so building this habit was the other part of counteracting some of the worry cycles that got activated for him. So that was just that example. I think I maybe went over a couple minutes. So anyway, that's the end of my talk on that. Leave you with the quote, worry doesn't empty tomorrow of its sorrow, it empties today of its strength. So we'll kind of leave on that and see if folks have questions or, kind of comments, or maybe sharing their own reflection of ways that you found to kind of work with this. And then in the rest of the things, there's the references for the Freeman stuff. I really like the compassion focused therapy references because they really work at worry in terms of the kind of self-compassion for self. And then the last slide is stuff that's just readily available online that I just thought was pretty decent in terms of just step-by-step things you can do or access in terms of working with worry. So